Joshi, I would really like you to take a lead on this, sir.
On the opinion of the lockdown. Well, I think we didn't have to have this lockdown if everybody had tried their best to comply with the rules and the regulation to keep safe, wearing masks, keeping the distance, washing hands. I think we realized that when we had the last lockdown, we managed to control things, and we were gradually getting towards opening up the economy. So this is, in my opinion, it's a very unfortunate. I think we could have avoided it if everybody in the society complied. I do understand that many people were a little bit frustrated with the length of the lockdown in the past, but we can avoid the lockdown, and I don't think we should have another one if we comply.
Major Mother, what do you have to say about the current lockdown?
Yeah, unfortunately, this happens because we found a very big group of people who are not obligated to rules and regulations, and they started to go out in groups as well as having social gatherings, which negatively affected to the increase of the cases of COVID-19. I of course agree with Mr. Chanwag that we could have avoided this if everybody obligated to rules and regulations, but according to what we have seen through the statistics issued by Ministry of Health, we really are in need for those restrictions in order to help decreasing the number as well as giving breaks for those who are working in the medical line.
About Major Mother medical line, we also have Dr. Sophia right now, who we ask what does she off about down. Dr. Sophia, what's your take on this?
Yeah, thank you very much first for inviting me today to the program, and I'm very happy to share my humble experience, probably a little knowledge about this matter. Actually, firstly, we all knew that the dramatic rise in the numbers of confirmed cases that we have of COVID, as well as the numbers of death tolls that we have already reached due to the pandemic. As a medical personnel, I think the decision taken to impose lockdown by the higher authorities is very timely and very precise and in place, actually. And all this was done actually in attempts, as my colleague says, to reduce the numbers of cases as well. Actually, the numbers of admissions to the hospitals that we really have overloaded them, especially when we talk about ICU, that, the burden has gone very, very high on it. And the lockdown actually is imposed to control the pandemic by reducing the spread, the virus, therefore the infection. And it's resulting in protecting the healthcare system from collapsing. And, I noticed as well they were probably reduced in the inter-regional spread of the viruses. We had lots of cases that, between regions that were very, very, very high. Actually, lockdown also has been practiced worldwide, not only in Oman, and some promising results were witnessed in some countries. This is a very good initiative which was taken by the authorities.
Thank you, Dr. Sophia. Talking about the movement ban for now, Major Mother, we all know that from 8 p.m. to 5 a.m. the movement is completely banned in the country. What are the penalties or the fines for the violators in this regard?
There is, first of all, it's not a complete ban of movement. We have, a space for those who are working in the medical services or those who are working in the logistics supplies. They are allowed to move during the restrictions hours. Also for those who are traveling, either using the airports, going outside flying or arriving to the Sultanate, also they can move during those restrictions hours. So regarding to the fines, there is financial fines starting from 100 riyal for not wearing mask, and it might reach to 3,500 riyal for not obligating the rules and regulations.
Wow, from 100 riyals to 3,500 riyals a fine.
Yeah, and this can be doubled if it goes to the courts. So it depends on the judge. He might double the punishment as well, and that will also
Oh,
could be jail or as well if it reaches the courts.
wow, this is really serious this time, because I remember last time the fines were not that high. It was still under I think between 100 to 500 riyals, if I'm not wrong.
Yeah, it was like that. Usually it was like that through the decision issued by His Excellency Lieutenant General Hassan Mohsen al-Shariqi. The decision 151 by 2020 shows the fines and the punishment for those who are not obligating to rules and regulations. So it was there, but we didn't apply it. But this time we are very serious in applying all those punishments.
Major Mother, you just mentioned that you know the movement in it's not completely banned. People, of course, medical officers are free to move around, and also people who has a flight to catch, or people who actually have to receive the passengers at the airport. For people who have a flight to catch and for people who have to receive passengers, what is the protocol that they need to follow?
So what they have to do is that they should have a copy of the tickets with them, either electronic copy, so it could be soft copy or hard copies, so they print it out. That has to be all with them all the time. One person with each passenger, so in the vehicle should be the passengers who are traveling, and one driver who takes them to the airport or take them back from the airport to their houses. So at least the maximum number is one. And they have to have the tickets with them all the time. It happens that some people have an emergency, they have to go to the hospitals during the band hour or the reception hours. So what they have to do is that they call the emergency number 49 and inform them that we are going to travel from, let's say, from Al Khuwair to Royal Hospital, for example. Our plate number is, the vehicle is having the plate number so and so, and they can go after informing the emergency line.
Thank you so much, Major Mudhir. Mr. Shaswar, I'll come to you now. So you know that the lockdown timings are from 8 p.m. to 5 p.m. I want to ask you, what do you think of these lockdown hours? Do you think they are going to be fruitful? They are going to produce a positive result in terms of bringing the numbers down?
Well, in my opinion, of course, it will reduce the number of people who are going to be congregating together. Most of the people tend to congregate in the evening. During the morning hours, they are at work in different places. So congregating together in the evening, that will be reduced, and therefore even moving and visiting within families, etc., that is also reduced. So it should have a positive impact to try to mitigate this increase in numbers. That's I think would be the case. We will just have to see how effective that is by after the 24th to relook at the numbers and see how many people have actually been infected or how the recovery has been.
Right, Mr. Shaswar. Next question for you, sir, is, what do you think are the possible consequences or the result of this lockdown for SMEs or even big established business in the country because of the lockdown?
I think most of the companies that would be affected in this lockdown would be restaurants, maybe the gyms, the cafes, the guys who are actually selling the shawarma stands and mashakik and all these guys. So it's mainly the entertainment side of the business would be impacted. The retail business, not as much, because people tend to adjust themselves, so they do a lot of their shopping requirements during the non-lockdown period. So businesses picks up at a little bit different hours. The matrah souk, for example, might be impacted because most of the people like to go in the evening there rather than in the morning to do any shopping in matrah souk. SMEs who are just beginning to do business in the restaurant business and smaller businesses, will be impacted. But the lockdown is for, at the moment, we see it is for a couple of weeks until we assess the situation. If we manage to open after those couple of weeks, I think the impact will be minimized. And I think the time frame the government has taken into account to try to minimize the impact of the lockdown on small businesses and these businesses as such.
Thank you, Mr. Shaswar. Dr. Sophia, I'll come to you now. First of all, Dr. Sophia, I would like to know, how is the work going to be for health personnel like you during this lockdown? Will you be taking in emergency patients? What about those patients who actually had an appointment before the lockdown came in place? How are they going to be accommodated?
Actually, in the primary health centers or care, we carry our services as usual, and we run normal clinics as usual. In the mornings, we see routine cases. We continue with the usual appointments in, like, let's say, chronic disease clinics, which are, of course, when we say chronic diseases like diabetes, hypertension, asthma. And we also run general clinics, but after which we filter the cases which are really and urgently needed to be, need to be reviewed, actually. During the lockdown, we usually don't encourage patients to come to the health centers unless it's an emergency situation, as we know, to protect those patients from any exposure and unnecessary contact and that. Our working hours, actually in the health centers, most of them, we do work from Sunday to Thursday, 7:30 to 9:30. Keeping and knowing that the last half an hour is based for only emergency cases that might come, and after those hours, after 9:30, patients of emergency cases can be directed to go to polyclinics or hospitals, of course. But during the lockdown, from 8 p.m., we only receive or accept emergency cases. But our clinics are not affected. Appointments are not affected because mostly they are at the morning shift. So we just continue, as usual.
Okay. Dr. Sophia, do you think, you are in the field right now, you are in the front line as a medical officer. Do you think this lockdown is going to be effective in bringing the numbers down, in your opinion?
Honestly, we hope, actually, with this decision of the higher authority, that will have wide and large reduction in the numbers of cases, as well as slowing in the rate of the spread of the viruses and in the infection. Because as we all know, the more we reduce and slow the spread of infections, the better the function of the health system in delivering suitable and efficient care to those who are really in need and mostly need the care. And this will also unload the burden of the hospitals and the medical personnel on ground. It is apparently noticed that the number of cases had drastically gone lower by percentage. But of course, we did not eradicate the virus. And just as other countries in the world, Oman has adopted the lockdown policy in attempts to contain the speedy spread of the COVID. And here we would strictly emphasize on actually the period of after the 2 weeks of lockdown. This is what we are thinking of. Not only that we're looking at the 2 weeks of lockdown, yeah, which is actually equally important. The 2 weeks, the period after the 2 weeks is equally important as those 2 weeks. By continuing, by people continuing to abide and adhere to the safety and preventive measures that are noted, actually. So we hope that the numbers would go down, because we notice that the gatherings are mostly at the evenings, as my colleague had, your guest had said earlier. In the mornings, people are either at home or at work, So the gatherings are more in the evening.
Right. Dr. Sophia, do you think the previous lockdown actually brought the numbers down?
According to the statistics that we had got, we had received, that they are reduction in numbers of patients. But actually, in my opinion, because I think that that lockdown came, I don't know, was it coincidentally with stopping of, when we stopped doing the nasopharyngeal swabs at that time. It could be the reason for noticing that drastic fall in the numbers. But in reality, we still see the numbers are there. You see, so we do, because we are in the medical field. We need patients. We see the patients. So I can't really tell you, absolutely that it was effective and it didn't reduce or not.
Thank you, Sophia. A Major Mother, we have a question your way, sir, right now. One of the viewers asking, since the beaches are already closed during the lockdown, there are no access to the beaches, be it private beach or public beach. They're asking, are people allowed to camp in the mountains since beaches are closed? For example, driving up before the movement ban and leaving after 5 a.m. So if I'm going, for example, Major Mother, before the lockdown time up to the mountain, am I allowed to camp there and then I leave at after 5 in the morning after the lockdown is over?
We have first of all to define what do you mean by camping, because gathering by all sort of means are not allowed if you exceed the number of 5. So let's say if there are 4 persons camping together or staying together with taking the precautionary measurements like wearing masks, distance, that's okay. But if it's more than that number, it's not allowed, because of course you know that gathering starts from 5 and above, and this is not allowed. So, but if you are talking about 5 and below or 4 and below, let's say 4 to 1, it's okay, it's allowed. But we don't advise to do that, because people should take all the needed measures to control the spread of disease. But according to the law, yes, if they are less than 4 persons.
Thank you, Major Mother. Mr. Shaswar Al-Balushi, I have a question your way, sir. I wanted to ask, especially during this time that the whole world is in the midst of coronavirus, not just the Sultanate, and having repetitive lockdowns in the country, do you think that is going to be fruitful for the...
Also speaking to Doctor about if the cases are actually reducing since the lockdown. We've been noticing an increase in the number of cases, and which is why the lockdown was imposed. And according to the doctor, even though they are trying to contain it, she cannot really comment on the numbers at this point. While we wait for our guests to come back, we're going to quickly go over the international stories. And once we have our guests back, we'll resume the talk on the lockdown with them. All right, so we've got Madiha back online. So let's quickly head over to Madiha.
Thank you so much, Antara. This is what happens when you're working from home and there is an internet glitch. Do we still have our guests on call with us right now? Yes, Major Mudar is still there. Okay, I see Major Mudar. I think I was talking to Mr. Shaswar Al-Balushi. I think his internet is also disconnected, if I'm not wrong.
Yeah.
Because I don't see him. Oh, Mr. Shaswar is there. Sorry, sir. My internet disconnected in between.
I can't hear you.
Can you hear me, sir, now?
I cannot hear you.
Major Mudar, can you hear me?
Yes, Madiha, I can hear you.
Okay, till that time, okay, so I think Mr. Shaswar, I'll just ask the technical team to get in touch with Mr. Shaswar to ask him to reconnect. I'll speak to Major Mudar till the time. So Major Mudar, we were just talking about the lockdown, and I'm glad you clarified that if you are heading up to the mountains, because, like you said, the weather is getting nice, people want to go out. So they have to make sure not to exceed the number, first of all, and also adhere to all the precautionary measures as well.
Yeah,
now, Major, I have to ask you that, do you think that the current movement ban will actually help reduce the cases of coronavirus in the Sultanate? Dr. Sophie already mentioned her point of view. What do you have to say?
Because what we noticed during the first and the second lockdown, that most of the gatherings happens at the evening time. So we hope that the lockdown will decrease the number. From my point of view, and through what we have seen in the studies issued by international scholars, that they believe that the lockdown or placing restrictions in movement of citizens and residents have or has very positive effects in reducing the number. So yes, I believe that this restrictions of movement will help, inshallah, in decreasing the number, as well as increasing the severity of disease on those who are affected. Inshallah, we hope so.
Are praying for things to get better soon in the Sultanate and across the globe. We have Mr. Shaswar again back online. Sir, can you hear me now?
Yeah, I can hear you. Sorry, we had a technology glitch.
Yes. Yes, exactly. It's all technology, you know. So you
Yeah.
were just talking about the effect on the economy due to the repetitive lockdown, and of course because of the coronavirus. You were just explaining your point of view.
Yeah, I think of course if we do not collaborate together in order to avoid lockdowns, repetitive lockdowns will have a negative impact and will slow down recovery of the economy. Plus, also one has to remember it does cost the government a lot of money to treat patients for the coronavirus. I think the number that I read recently is about 1,000 riyal per day per individual, and that's not a very small amount of money. Also, to put the ROP into action for lockdowns, it does cost them money as well. You know, the staff, the helicopters, the late hours work, etc. So it's all it's about the economy at the end of the day, and if the government is not having the money in their hand to stimulate the economy, it affects the recovery. Also, the lockdown affects the private sector. So the quicker we come to agree that every individual has to play on an individual based role. We wear masks, we keep our distances, we wash our hands more frequently, we try to protect ourselves and others. I think the quicker we will see that we are coming into to control this particular virus. And maybe Dr. Safia will be able to elaborate, but we are also entering into the influenza season. You know, winter change of weather also brings influenza with the COVID. So we have to be extra careful. We really have to be extra careful if we want to see the economy go back.
Right. Mr. Shaswar, you know, Major Mother already mentioned that, and even Dr. Sophia said that the cases, like one of the reasons that they see that lockdown is in place because we were not adhering to the rules and regulations issued by the Supreme Committee and the Ministry of Health. Despite all the things that people are doing right now, do you really think that lockdown is the only solution to control the spread of the disease right now?
I think the lockdown is a result of non-compliance. It's not really the solution. This is like a tranquilizer because we got out of hand and the pain is increasing. The actual solution is that each one of us has to say, okay, for the next 3 weeks, I am going to limit my outgoing. I'm not going to go out as often as I am supposed to go. I need to change a little bit my timetable and my lifestyle to make sure that I don't, do these major entertainments. You know, if there is any weddings or parties, we can delay them. If it's birthday parties, we can have them on Zoom or something like that. You know, so we just need to change our lifestyle for the next 3 weeks, 4 weeks, all of us collectively. And I think that is the solution. The solution is not in the lockdown. The lockdown is primarily a reaction to our inability to adhere to the regulations. So the more we each individually say, okay, guys, I'm sorry, my family, you have to bear in mind that the next 3 to 4 weeks, I'm not going to be visiting you. I'll be calling you more often, or we will have Zoom meetings rather than then coming face to face and meeting. Okay, and at work also we added to the rules and the regulation. This is when we are going to see a solution to the drop in numbers.
Aswar. Now, talking about the economy and the revival of the economy, how long, in your opinion, do you think, considering the lockdown, considering the coronavirus situation across the globe, how long do you think is going to take for the Sultanate's economy to revive? Also, now, sir, that the partial opening of the Muscat International Airport happened earlier this month. Do you think with the partial opening of the airport will also bring some sort of ease to the economy?
The opening of the airport, of course, will start to bring some sort of an ease, at least for the business people to come and go and start to do businesses together. The tourism side of things, I think it's going to take a little bit of time because most of the people, not because we don't want to have the tourists, but actually the tourists themselves might want to keep a little bit away. They are afraid to travel. The quarantines, etc., and so on. And I think that's also prudent. We have done a little bit of analysis, and I think, in my estimate, the recovery, of course, will be gradual. We will see a fair recovery by the end of 2021. By middle 2022, we will see us beginning to see a robust movement of business. But this is only subject to us collectively agreeing to self-control and self-implemented lockdown. I don't think the government should come and be able to tell us that stay at home. We should do it ourselves. I mean, we are all responsible people. We don't need the government to come and force us to do this. It's not fair, and I think the government is doing a lot of work, and they need to focus on other things. So let's give them the opportunity to focus on other things, and let us do this to help drive the economy forward.
Dr. Sophia, any piece of advice you would like to share with our viewers and listeners right now? One thing is already established, that the lockdown is due to the non-compliance of people like Mr. Shaswa, like Major Mudar and yourself just mentioned, that it is increasing and it is still there because of the non-compliance and not adhering to the rules and regulations issued. So what piece of advice would you like to give to the people out there now? Dr. Sophia, can you hear me?
Yeah. Can you hear me now?
Yes, I can hear you now.
Okay. So I was saying that it's first and foremost, everyone definitely knows that this is a serious and critical condition. Therefore, on a personal level and as well as community level, every person is responsible, as your guest has said earlier, for adhering to the rules and regulations narrated and well noted by the national and health authorities. And those are, by integrating those simple safety measures actually in there and incorporating it in their own lives. So you have to protect yourself and protect others from this disease or from this virus by staying safe and by practicing very simple precautions, such as physical distancing that we repeat again and again and again. Try to make wearing a mask as a normal part of being around other people, and just don't feel comfortable about those people who are you're so close to, avoiding those crowded places. Never forget the basics that even our religion has been, teaching us this, like hygiene, good hygiene, washing your hands with soap and water. If it's not there, then the alcohol-based hand drops, avoiding touching your eyes, nose, and mouth. These are from the medical point of view. Try to clean all the surfaces and disinfect any frequently touched surfaces. But the most important thing is washing your hands after every contact, basically. and the physical distancing, as we have mentioned before. That's my advice to everyone.
Thank you, Dr. Sophia. Major Mudar, what piece of advice would you like to share with our viewers? First of all, thank you for sharing that the penalties are really high, and there is also going to be jail terms. So I'm sure people are going to be very, very cautious now.
Yeah, of course. So I advise everybody to start to be responsible enough to take care of himself and those around him. I mean, as Mr. Chena was said, that we are mature enough to know what is good for us and what is bad, and how we can avoid getting affected by the disease. Also, taking the personal safety measures and make those measures as a daily habits is a good idea and a good thing to start with. During the lockdowns or the restrictions hours, we should use or utilize those hours to spend them with ourselves, reading books, starting to get to know those who are living with us. I mean, most of us as youth goes out and so everything. We don't spend enough hours with our families, so let's utilize those lockdown or restrictions hours to stay them more with our families. And all what we can do is to ask God to help us and to give us health and save us and save those those whom we love, and to protect them from getting infected by the disease.
I mean, thank you, Major Mudar. Mr. Shaswar, the same question goes out for you, sir. What advice would you like to share with our viewers right now?
I think everybody has given fair enough advices. My advice is, please listen to my other two colleagues and try to comply as best as possible. Keep safe and keep others safe. And let's work together to achieve our objectives of improving the economy, improving the health, and saving money for ourselves and for the government as well.
Thank you so much, Mr. Shaswar. Thank you, Major Mudar. And thank you, Dr. Sophia, for joining us today in such an informative discussion. Thank you so much.
Thank you.
Thank you.
Thank you.
It's time for us to take a quick commercial break, but you all stay tuned as Antara will be coming up with latest updates from our international desk.
Oman's largest online supermarket now has no minimum order limit. From grocery to household items, Rafiq has everything that you want. Enjoy worry-free shopping with over 8,000 products to choose from and get it delivered straight to your doorstep. Rafiq, you order, we deliver.
Welcome back to the Outline. You just heard Madiha talking to our three very special guests about the lockdown. Now coming up are the international stories. The UAE on Tuesday announced 1,315 new COVID-19 cases, bringing the total confirmed cases in the country to 108,608. At the same time, 1,452 more patients have recovered from the virus, taking the tally of recoveries in the UAE to 100,007, UAE's Ministry of Health and Prevention said. It also confirmed 2 more deaths, pushing the country's death toll to 448. The UAE was the first among the Gulf countries to report COVID-19 cases. It has been showing solidarity with China in its fight against the novel coronavirus. On Feb 2nd and March 12th, the iconic landmarks in the UAE, including Burj Khalifa and Dubai, were lit up twice in the colors of China's national flag to show its solidarity with China. In late April, the Chinese Consulate General in Dubai organized an online conference for Chinese doctors and medical experts to share experiences in preventing and treating the coronavirus with UAE counterparts. Spain's Health Minister Salvador Illa said on Tuesday that the central government was not considering an early end to the state of alarm, which was imposed Friday on the Madrid region to curb the spread of the coronavirus. Illa responded to an appeal from Isabel Diaz Ayuso, president of the Community of Madrid, to lift the restrictions. Speaking on Spanish radio station Cadena Ser, Illa insisted that currently the circumstances do not exist to lift the mobility restrictions imposed on the city of Madrid and 8 other municipalities. Travel restrictions were imposed on a further 4 basic health areas in the region on Monday after they showcased an incidence rate of 750 new COVID-19 cases per 100,000 inhabitants. Under the new rules, no more than 6 people are allowed to meet at any one time, and bars and restaurants have their capacity limited to 50% in the whole Madrid area. Earlier recalled that the criteria for imposing restrictions were an incidence rate of 500 new COVID-19 cases per 100,000 inhabitants, over 10% of PCR tests giving positive results, and over 35% of intensive care beds occupied by coronavirus patients. Those with international stories will take a short commercial break and we'll be right back.
Oman's largest online supermarket now has no minimum order limit. From grocery to household items, Rafiq has everything that you want. Enjoy worry-free shopping with over 8,000 products to choose from and get it delivered straight to your doorstep. Rafiq, you order, we deliver.
Welcome back to the Outline. Coming up are the sports stories. Chennai Super Kings beat Sunrisers Hyderabad by 20 runs. After some late carnage from Ravindra Jadeja, CSK reached 167 runs with 6 wickets down after 20 overs. However, CSK's bowling attack strangled the chase as SRH ended with 147 runs with 8 wickets in their 20 overs. In a shock move, CSK kicked off things in Dubai with a new opening pair in the form of Sam Curran and Faf du Plessis. While Curran smashed some boundaries in his 21-ball stay at the crease, du Plessis was sent packing on a golden duck. SRH were rocked early by Sam Curran. Kane Williamson held the chase together even as CSK kept picking wickets. With the required run rate climbing, SRH catapulted under pressure and CSK saw the win through. International Olympic Committee President Thomas Bach said that the Tokyo Olympic Games will be held under any circumstance next summer. In a video message released by the Tokyo 2020 Organizing Committee, this is what Bach told chef missions of all national Olympic committees. Tokyo continues to be the best prepared Olympic city. The health and safety of all are concerned remain our top priority. We are focused on developing a toolbox of COVID countermeasures for every possible scenario, encouraging development of rapid testing and vaccines. It gives us good reason for cautious optimism. He added that they are prepared for safe Olympic Games, whatever conditions the world will be facing next summer. Those were the stories. We'd like to once again thank our guest on the show today, Mr. Shashwar. He pointed out that the lockdown this time was because of our inability to adhere to rules and regulations. Major Mudahir reminded us about the fines and penalties that we have to bear this time. And of course, Dr. Sophia told us how we should embrace our new lifestyle, wear masks at all times and practice social distancing. We're again going to touch on interesting topics, so stay tuned tomorrow for a midday update.
You've just heard the live feed from the TTV studios on TFM 95.4. Let's talk.